Hi, it's Jessica DaMassa with WTF Health. Joining me in the HISA studio right now, I have Kudzai Kanhutu. She is the chair for HIC 2019 and also the Deputy Chief Medical Information Officer at Royal Melbourne University. So great to have you here. A beautiful conference you've put together.
Thank you.
So I want to jump in because one of the things that you've said was really important to you in terms of this conference was the gender gap in digital health. And so I want to jump in and just hear right off the bat, what are you seeing here in Australia in terms of that gender gap when it comes to health informatics, digital health, health technology?
Yeah, look, I think one of the things that was really apparent to me when trying to come together with a design brief for what I wanted the conference to be is that you're really bringing together two worlds that are traditionally very gendered and gendered in a very male way. So medicine, healthcare has traditionally had most of the power sort of accruing for, male figures of authority. And then you have IT or, information technology, which again, it's well acknowledged that it's a space that generally excludes women, and those exclusions come about structurally. So then trying to bring together a conference program that tries to redress that balance and to make people feel welcome first and foremost, because I've always really believed in that old adage of, you can't be what you can't see. So trying to tease out the people within that fabric of digital health who would represent a diverse perspective on what success in digital health can look like, and to give people that opportunity through the conference.
Give us a sense of the gender disparity here and in those places. So it's like for those who've never been to Australia, who may never encounter the health system or unfortunately come to HIC, but if they've never been here, what do they see? Is it mostly male, like 90% male, 20%? Give us an idea.
Yeah, so I guess the best way, because I think in many ways the digital health community and the HISA community is probably not representative of what happens out there in the big wide world.
Okay.
So within HISA, I've really found that there is a lot of I don't know if it's happened organically, but there is actually a good sense of, good representation of women and men, gender, and, professional backgrounds as well across the spectrum of people who are just beginning and people who are really advanced in their skill set and are acknowledged as being experts in their field. But at the same time, when we're looking to broaden that community, we're then coming or extending ourselves into areas like medicine, where we know that, for example, in surgery, so one of our speakers yesterday, Ruth Mitchell, spoke about that surgical journey and the acknowledgement that there are some specialties where, less than 10% of people graduating in orthopedics or some of those surgical specialties will be women. So there are clearly some pockets where there's something going very wrong, because 10% of the population are not women, but why is it that only 10% of some certain surgical specialties are ending up with female graduates? And the same thing applies in IT. So IT is obviously not my professional background, but if you look at the growth of conferences like HOPA, which was in Australia for the first time this year, it really speaks to a community of women who feel like, for whatever reasons, structural reasons, they've not had the opportunity to become IT professionals and really be involved in that journey. So they're trying to find ways to penetrate in. I think the statistics for some areas of information technology are similar. 10% women, 20%, but the vast minority of people being involved in that sector as being female or identifying as women.
It's interesting to me, so I'm curious, like in the working world, because you're right, I have not felt that here at this conference. I really have been. It struck me, like how many. It was just so natural. There were so many women on stage, and it was like I actually thought to myself during a panel yesterday that had, I believe it was 5 women, one man, and the moderator was a woman as well. And I thought, I'm so surprised nobody even tweeted anything about there being no manels at this conference, because that's such an American thing. Like we are so on top of that because there's so much gender imbalance. And this was going the other way, and I was like, this is fantastic. So, but in the real world, like you've said, this might not be necessarily an accurate sample. In the real world, what is the experience, I guess, for women in the health system or in the health IT space in particular here in Australia? I've talked to leaders in this space in the States and in Europe, and even in Japan, but I'm curious to know, what's the experience for a woman in health IT here in Australia? What's it like?
You really are bound by context and whatever environment you're working in. So I'm really fortunate. So at Royal Melbourne Hospital, we have our Chief Medical Information Officer is a woman, and I work alongside a male colleague in the Deputy CMIO role. So we have some really good, and the director of our EMR project is a woman as well, and so that when you're there, you don't feel like it's an issue. And I think that panel yesterday again was that moment of, I'm so relieved nobody feels it's a thing, because we've kind of been building that in the audience and the delegates and in the last few years of programming to make it feel normal and natural, so that people aren't thinking, oh wow, did you just see that?
Like it's like an anomaly.
It shouldn't call attention. It shouldn't call attention to itself when you do it right, and also when you're acknowledging the fact that if you're making a choice, and I think that's what it comes down to, if you're making a choice and you have two people, who are equally able, acknowledge that they're equally able and offer those opportunities to both of them, and then they can decide, rather than you coming with your own biases and deciding for them. So when we are thinking about things like workshops, so we're getting an EPIC implementation, and we're thinking about how do we invite people or put out an EOI for people to be involved in, physician builder or advanced level classes. Most people, when you say, okay, I want you to think of one person who you think should be invited to the course, I guarantee you most people would think of a male colleague.
Sure.
Oh, because he really loves IT and he's really good at it. Where I'm thinking, well, offer it to everybody and tell them at the outset, if you have a vague interest, you can upskill in this, because nobody is born knowing how to code. You are born, you show an interest, you invest a lot of time, and all of my friends who are really techie and geeky, they spend hours. It's not a case of they're just, naturally
What? It doesn't come with a Y chromosome, the ability to code? Oh my God.
But it's just continuing to reiterate that message around, if you have an interest, you can get there, and it doesn't really matter if you're starting from zero. If you put in the effort, you'll get there. It's like training any muscle. If you put in time and effort, you'll get there. It doesn't matter if you're a woman or not.
Any insight on the pay gap as far as women in health IT versus men in health IT?
Yeah, the pay gap definitely exists.
Is there a leadership gap as well, like where women are not getting into like the chief CMIO roles, or
Yeah, there is definitely a pay gap and a professional gap in terms of your ability to, rise up the ranks. If you think about all of it, particularly in that CIO space at government level, if you look across the country, I don't think I can think of any of the state governments that have female CIOs. But that's not to say that there are not women who would be capable of doing that role. But we are kind of riding, it's a wave, and it will change. But I think conferences like this are a real tangible opportunity for people to not only see these people, but to also sit down with them, have a chat with them and go, so that's how you did it, and have those discussions around, so you did this and then you did that. Because sometimes when you're looking at it from a distance, you can think, well, I couldn't possibly do that.
Right.
But when you're at conference, you actually get to say, so you did nursing, or you did a medical degree, or you did physio, and then you did this course, and it allows people to join the dots in a meaningful way, so that they can actually see, that could also be my transformation path as well. That makes a lot of sense. It's not magic.
No, it's years of hard work. I wanted to ask also about the conference, transitioning away from this gender conversation. What else was important for you to have? What 2 or 3 big topics did you just really want to hit home on here at HIC 2019? I mean, I can tell you what I've seen, but I'm curious to know, as the person who is kind of one of the driving forces behind curating the speakers and the topics and the themes of the sessions, what were some of the things you wanted to hit on?
I think the 3 really big things for me were around population, so starting to think about data at scale. Ethics, so how are we actually building this new world? Climate was one that I really wanted to kind of start playing with start having people think about, when we work in health, often we have what I like to call a moral offset. Because I do good things and I do wonderful things and I help people, I don't need to worry about the planet because I'm doing good things. And people let you get away with it in healthcare. I can have the dryer on all day and drive a 4-wheel drive with gas coming out, but I'm a doctor, I'm okay, I'm doing good things. But to try and start to tease that out from some of the panel sessions and some of the presenters. And the final thing for me was unsung heroes. because I think there's a...
Like who?
I think the people from the Country Fire Authority today, they are really our unsung heroes.
Yeah, and just for those who are not here, the Country Fire Authority, it was a firefighter and a senior researcher for the fire agency, and we spoke with them in an interview, so take a look for that one too if you want to hear what they have to say. But it was incredible. They were talking about how they've done this massive research project, thinking that the models of the way fires spread through the bush were wrong. They undertook all this research and found out that they were right, and so they collected all this data. But say more about why you picked them, because I think that's so interesting.
I picked them because there was a part of me that also really wanted to tap into those, disaster and emergency relief services that we really rely on so much, but don't tend to have a visible voice or a visible presence. They go about doing their work, whether it's, police or ambulance drivers, people working really at that intersection of, if they get things wrong, people will die. It's really life or death. And they are not people that normally get invited to a conference like this because people aren't able to see the links between how they use data and how, when they were telling that story about how they're using data, I'm like, that's exactly what I do in a clinical consultation. You have a lot of unknown factors, there's a lot of contextual factors and a little bit of chaos around it, but somehow you need to find the marriage between the science of what you're doing and the art of what you're doing. And I think when that happens, it's a really magical moment because you suddenly go from, I turned up thinking, why on earth would you get people from the Country Fire Authority to come to HIC 2019 to, I get it, they're doing the same thing we're doing, and it's just really cool that they were actually able to come, and in the uniform too. I was like, you wore the uniform.
Yeah, the uniform was next level.
I mean, I was like, that's winning.
And how many terrible fire, FHIR jokes and FIRE jokes? Oh yeah, I'm guilty for sure.
We managed to put them all into the same session. So I was really happy about that because it's good to hear the stories from the people who are also doing the work. Because sometimes, you'll end up with someone who's like the media or the PR person to come.
Right.
He said, no, you got the woman who actually does the lighting of the fires, and she said
runs along
with her hands singeing to kind of film that footage, and you get the man who come this summer will actually be out there working, putting out fires and putting all of this data into real actionable practice. So cool. And I wanted that to be part of the story of this year, is that for all of the things we kind of get upset about, we're not using the data, there are some people who are using it and using it to incredible effect. Why don't we give them a platform to kind of get a round of applause for doing that?
This was a beautifully curated conference, I have to say, so congratulations for that. HIC 2020, do we know when that is? Can you shout out a date?
HIC 2020, I won't state dates because I might make a mistake, but it's going to be, we're heading north again, we're going to Brisbane.
Okay.
So it'll be nice and warm, not that it's been terribly cold here, but so next year. And
everybody should check out the HISA site to find out the exact dates of it. We won't put you on the spot there anymore. Thank you so much for joining us. It's a pleasure to talk to you, and congratulations on HIC 19. Wonderful job. I'm Jessica DaMassa with WTF Health here at the HISA studio at HIC 19 with the chair. Thanks so much for joining us.